to our first presenter, Mary Symmonds, whose topic is I Am Woman, Hear Me Row. Mary Symmonds is a retired United Nations executive and international economic and nurse practitioner. Her career has focused on economics and social development in Africa. She's also the founder of the Global Leadership Coalition, which builds social, responsible, ethical, entrepreneurial young male and female leaders between the age of 18 and 29. She's also the president of hcqcaa USA. Mary is a contributing author of Amazon's bestseller, The Art of Resilience, Phoenix's Rising, curated by Dr. Joy Vaughn. She's also the Matthews Business Network Regional Chair for Africa. We bring you Mary Symmonds. Thank you.
Thank you. Okay, thank you very much. And okay, so can you go to the next slide? So today what I'm going to cover is a very quick overview of women's rights and women's health, and then go on to rights of reproductive health and why it's important, examples of the impact of denial of reproductive rights. I'll touch on the US reproductive rights and Roe v. Wade and future implications of the reversal of Roe v. Wade, and end with the centrality of women's autonomy. So next slide. Okay, hold on. Yeah, so since the 19th century, women have been coming together to claim their rights. And initiatives started as early as 1888. And these initiatives were led by women of the North, and they were effective in integrating women's rights into the creation of the United Nations. So from the very outset of the United Nations, we've had women's rights being integrated. Since 1937, women were ensuring that the legal status of women was examined. And while the right started with the right to vote, over time, the question of rights broadened, and the women's conferences were initiated in the 70s, early 70s, with the first conference being held in Nairobi. And a significant achievement was the integration of women's reproductive rights into women's rights, and also speaking about the concerns of women of the South. So for a long time, women of the South had no voice when it came to speaking about issues that were related to the relationship between men and women. Okay, and then next slide. Okay. Sorry, let me come back here. Okay, so as I said, 1995 was the turning point in bringing the North and the South together. And some key achievements included the introduction of the concept of reproductive rights, and embracing that. By then there was the Declaration of Human Rights, and therefore this rights-based approach emerged. So what we also saw evolving was a definition of reproductive health, and the importance of considering the complete physical and mental health and social well-being of women. And this also gave the opening to looking at the fundamental freedoms that were guaranteed under the Declaration on Human Rights, and the various covenants that gave rise to guaranteeing civil and political rights. Okay. Sorry, excuse me. Next slide. Okay, yeah. So as things evolved, also it was important to have indicators, and maternal mortality emerged as one of the indicators of women's access to health. It is still an important indicator, and it is integrated into the targets for the Sustainable Development Goals, which are to be achieved by 2030. And here they're looking at the number of deaths related to the process of birthing and related to live births. And they look at the number of deaths per 100,000 women. And so there is a core element of the women's rights as the discussions strengthen and evolve is the question of women's autonomy and choice, and giving women the right to make decisions concerning their fertility and sexuality free of coercion. And a little later, I'll talk about a few examples of the types of coercion that have obtained. And I believe that in the discussions that we are having right now in the United States, we are also witnessing that even after all of this journey, we are still having these issues around coercion. But let's move on to the next slide. Now I'll give a few examples of the impact of the denial of reproductive rights. And so one of those is the failure to allocate resources to ensure provision of services. So I'll take an example and this happened at the outset when they were setting the baseline, but these are very important illustrative examples. So in Azerbaijan, there were budget cuts that resulted in the decrease in the number of maternity and health centers. And in addition, despite the fact that maternal care during maternity was officially provided free of charge by the state, there developed, an informal demand for paying for those services, which then, of course, denied women who were vulnerable, women who were poor, from their right to access to health services. And that all of these examples take you back to the indicator of maternal mortality, as you can imagine. In Croatia, contraception was the first medication to be removed by the state for funding within their public health system, and the budget cuts that required, some economic stringency. Abortion was also removed, and that had the consequence of contributing to adversely affecting women's health outcomes. And, for some examples of that, the decreasing the access to maternity centers and health centers. Another example I want to give is this occurred in Zimbabwe, and that's the denial of reproductive choice and abortion. which in its, ultimately led to unsafe abortions. Reports that were received as a result of that denial of the reproductive choice, women then suffered things like hemorrhaging, loss of blood, caused by resorting to illegal abortion. This also obtained in the Dominican Republic. So there is another example I wanted to give you, because in Cote d'Ivoire, for example, the right to abortion is illegal. But it has not stopped abortion. So they have experienced continued cases of abortion with the resultant increase in maternal mortality and morbidity. An interesting report was that although they got some assistance from the United States through the Millennium Challenge, there was conditionality. And that conditionality also required that that funding did not go to abortion as part of a range of choices that would allow for the management of women's health. An interesting case in Mexico was the lack of confidentiality. So although the right to abortion and contraception was given, the lack of confidentiality was a deterrent for women seeking those services. And coming back to the case of Zimbabwe then, what we see is there are laws that enable access, but practice denies women the right to exercise their right to access facilities, whether it is through lack of confidentiality, or in the specific case of one of the case studies from Zimbabwe was denying teenage girls the right to have contraception, for example, on the grounds that they were not expected to be sexually active. So those are just a few examples of the impact of the denial of reproductive rights, which ultimately lead to worsening the indicators and the health outcomes for women. Next slide. So it's very interesting. I just want to touch briefly on the United States. So before 1967, the US abortion laws were very restrictive. And then there was this important development in 1972 with Roe v. Wade that gave, the right to women to have abortion under the conditions that were specified. The political structure of the United States also brings about a tension between what's on the law and what happens in practice. And as a result, it's not only the abortion, but it's also health policy that have led to a situation where the United States has the highest levels of neonatal mortality and morbidity. And just to give an example, back in 2015, more than 5 million pregnant women in rural areas had no access to adequate health services, whether it is to gynecology services, health services, and so on. And as we have, it's important, we see all over the world, including in the US, that vulnerable groups are the most impacted by inadequate access to reproductive rights and services. And as we see, 61% of women who have abortions in the United States are likely to be women of color, and 28% of those being Black, and about 24.8% being the group that they described as Hispanic. So Roe v. Wade would contribute to that worsening performance in health outcomes. Next slide. So what I want to leave you with is the importance of women having autonomy over the decisions that they take about reproductive health. And this is a quote from, sorry. Yes, this is a quote from Isaiah Berlin in his essay, Two Concepts of Liberty, right? And in that, he talks about negative liberty, negative right to freedom. And I'm not going to go into that, but he talks about the positive right to freedom. And the positive right to freedom being autonomy, in the sense that one is entitled to recognition of one's capacity as a human being to exercise choice in shaping one's life. And so I will quote from him because I find this very inspiring. I wish to be an instrument of my own, not of other men's acts or wills. I wish to be a subject, not an object, to be moved by reasons, by conscious purposes which are my own, not causes which affect me, as it were, from outside. I wish to be somebody, not nobody, a doer, deciding, not being decided for, self-directed, and not acted upon. I wish above all to be conscious of myself as a thinking, willing, active being, bearing responsibility for my choices and able to explain them by references to my own ideas and purposes. I feel free to the degree that I believe this to be true, and enslaved to the degree that I am made to realize that it is not. And I just want to leave you with that this cry for autonomy is so present here in the United States and elsewhere. Thank you.
Thank you so much for that outstanding information and presentation. We really do need to realize that we are all somebody, and we have the ability to exercise our rights. And I hope that you will do that, especially in making sure that you vote in the upcoming election, because that's an opportunity for us to let our voices be heard through our vote. So thank you so much for that very provocative lecture.